So, what is a wound? We talk a lot about wound care, but what is a wound exactly? So is this abrasion on this man's leg a wound? What about this surgical site here? Is this considered a wound? How about this lateral hip pressure injury? Is this considered a wound? This lateral ankle, is this a wound? Or how about this plantar aspect of the foot? Would we call this a wound? So let's define what a wound is versus an ulcer, because these terms sometimes are used a bit interchangeably. And I think it's worthy of taking a moment just to clarify from a definition perspective, what is a wound and what is an ulcer? A wound is defined as an injury to the body, as from violence, accident, or surgery that typically involves laceration or breaking of a membrane, such as the skin, and usually damage to underlying tissue. So when we talk about a wound, we're really thinking of like an external cause that causes that break in the skin. So like a surgical wound where we have a scalpel that's causing a break in the skin, a traumatic wound, a puncture wound, those are things that we would typically call wounds. As opposed to an ulcer, the technical definition of an ulcer, and there are a variety of different ulcer definitions out there, but the one we're using for today is a break again in the skin or the mucous membrane with loss of surface tissue, disintegration and necrosis of epithelial tissue, and often pus. So it's a bit vague, but what we're saying is it's a break in the skin with loss of tissue, maybe some necrotic tissue, maybe some, thickened drainage, but we're thinking more of an internal cause for an ulceration. So when we say a diabetic ulcer, it implies that there's an internal problem that's causing this break in the skin. So for example, diabetic ulcer would be maybe structural changes of the foot or sensory neuropathy, maybe some blood flow issues. These are all internal factors that are causing the external break in the skin. Or a venous ulcer, same kind of concept. We have problems with the venous system, with congestion of the venous, with venous hypertension distally in the leg, and that internal problem with the vein causes the external disruption of the skin. So that's how we would define a wound versus an ulcer, external versus internal causative factors.